Hello, we are live Tuesday night, Facebook Live. I'm here. I've got some great questions, and I know what you're thinking. Who is this guy? What's going on? Well, I can explain everything. This is a live Q&A with me, yours truly, JJ Staiano, Consultant Plastic Surgeon. If you've got any questions, feel free to please ask them to me live, or you can post them to me and I will answer them privately, and then you don't have to be recognizable, or because I won't mention your name or anything like that unless you want to be mentioned. Susan's in the house. Hello with treble O. Nice to see you here, Susan. If you feel free to chip in, please comment and share. If you've got any questions or any comments on what I am saying, then feel free to chip in. Also, there's a podcast every week. I think it's every week. Well, obviously I do this every week, so it's this basically as a podcast, and we got a YouTube channel as well where we split up the questions and put them on YouTube. I think we put a whole lot on YouTube as well. Anyway, so we got some good questions tonight, and I am going to get straight in with questions from one of my viewers. I don't know if it's a viewer actually. It's a question on the Facebook Messenger. Can I combine a Fleur-De-Lis and a breast uplift with implants? So here we go. Hi there. I keep having you tagged in my questions regarding surgery. That's good, I guess. I'm not quite sure what being tagged means, but I can assume it's a good thing. Anyway, so I thought I'd just message you. I am needing a Fleur-De-Lis and uplift. I want uplift with implants. Do you recommend these done as separate procedures? So tummy tuck on its own, then uplift with implants, or tummy tuck with just uplift and go back for implants another time? I get contradicting answers when I go for consultations. New one was don't like to do uplift with implants, but can do FDL with uplift. It's baffled me completely, as I really don't know where to start. Any help will be appreciated. Well, you know what? I can totally understand what's happening here, and I can totally understand this bafflement and this confusion. So what I've actually done is I have done a blog post to address this exact problem, because I see a lot of people saying, look, one surgeon said this, one surgeon says I need the implants over the muscle, one says under the muscle, one says round implants, one says teardrop implants, one says I need a lift, the other one says implants, fat grafting. They're all saying different things, and everyone's saying different things, and I can understand as a patient you might be thinking, how can this be? Surely there must be a way of doing things. Surely it must be straightforward. The problem is plastic surgery is still very much I guess they say it's an art more than a science. There's some operations, some branches of medicine where it is much more scientific. There's algorithms to follow. If there is this, then you do that, whereas plastic surgery is still opinions, experiences, and everyone will have different experiences. And I can totally understand why these different surgeons are saying different things. Some saying I'm not going to do a Fleur-De-Lis abdominoplasty and a breast procedure at the same time. Some are saying I'm not going to do a breast uplift and implants at the same time, but I will do a Fleur-De-Lis with a lift, and then you have implants later. All these things. I can understand this because these are all not unreasonably held opinions of different surgeons, and there are reasons that they have those opinions. There are reasons why they won't do a breast and a tummy procedure at the same time. There are reasons why they won't do a lift and implants at the same time. And there are reasons why you might want to do it at the same time. And what it comes down to is surgeons' opinions, and no one is right, no one is wrong. And one of the problems that I see all the time, and one of the issues with this sort of stuff, it's elective surgery. So people will obviously do research, and we encourage you to do research. And I think it's good to do your research because you've got time to do your research. It's not like it's emergency or urgent surgery. You've got time to do your research. But the more research you do, the more you get bogged down into the quagmire of what is the right operation for me. And I can tell you now, the answer, you're not going to find an answer. There isn't an answer. If there was an answer, you would start seeing it all the time. There isn't an answer. It is reasonable to stage a Fleur-De-Lis, a tummy tuck, and a breast procedure. It's reasonable to not do them in one go, but it's also reasonable to do them in one go. So there is no answer. There is only opinion. And I think sometimes when you go for a consultation with a surgeon, it's easier for the surgeon to just say, look, you're better off having it done separately, or you're better off having it done in one go. And then you, if that was the only surgeon you saw, you'd probably go and do what they said, and that would be that. But the fact is, you went and saw another surgeon who says do it another way. So my take-home message of my blog post and of this is that don't worry too much about it, and choose your surgeon. The most important thing is choose your surgeon, and look for someone who you think is sounding like they're talking sense, so that and are reasonable, and that you can talk to and have a discussion with, and talk about the pros and cons, and try and make a balanced judgment. You just got to make a balanced judgment. There are pros and cons. There's not total pros for one and total cons for the other one. Otherwise, we wouldn't even tell you about that. No one would do it if it was a bad thing to do. But the fact is, people say they do it all different ways. I think I rambled on about that a bit too much on reflection. But anyway, so basically, the bottom line is, if you want to have a tummy tuck and a breast procedure, you can. A Fleur-De-Lis tummy tuck is quite a big tummy tuck. It's this sort of inverted T-shaped one. So it is quite a big op. But you can have that at the breast same time as a breast reduction. A breast lift plus or minus implants. But that is quite a lot of surgery to have in one go. But if you want one time off work, one lot of recovery, I can understand why you might want to have it in one go. But you'd have to be prepared for a big operation with lots of wounds and potential for complications and healing issues. So it would be quite stressful to do that all in one go, but it would be possible. Same with the lift and implants. A lift and implants is possible to do in one go, but a lot of surgeons don't do it because it does increase the risk of complications. Because when you do a lift, you tighten the skin, and when you do implants, you tighten the skin. So both of those things are tightening the skin, and so you have to you do increase your risk of complications when you combine a lift with implants. So some surgeons will say, look, I'll do a lift first and then the implants, or vice versa, to reduce your risk of complications. They're not doing it to make life difficult for you. They're doing it because they want to reduce your risk of complications. Now, you might say, listen, I want to live with implants. I want it in one operation. I don't want to have two operations. I don't want to have to pay twice. I don't want to have two lots of recovery. And I'm happy to accept the risk of an increased risk of complications. So for that reason, some surgeons, myself included, do it in one operation. But there are reasons not to do it in one operation. And I talk to people about it. And I come to the overriding thing about lift and implants, which I said I'd talk about today, and I'm not sure if I've got a question about it, so I better talk about it now. Have I got a question about it? Because I did say I'd talk about it. So I've got another patient who's she's not a patient, she's just a person who's contacted me on Facebook asking her, saying her breasts are deflated. Does she need a lift? Does she need implants? This is a very common thing. So the question is, do I need a lift or implants? Very common question. And I said I'd talk about it. I thought I'd talk about it in this question, but anyway, I'll tack it on. Again, big question, very hard to talk in general terms because it depends on the person. That's why you're better off having a consultation. Again, lots of people look for answers online, and you often can't get answers online. You can just get opinions, and sometimes people can be very opinionated and say, yeah, this is the best way to do it, just because that's the way they had it and they had a good result, or this is a terrible way to do it because they had it that way and they had a bad result. It doesn't necessarily mean the way is bad. It might just be their result. So broadly speaking, question to answer is, what size bra do you wear? Are you happy with that size of bra? So if your breasts are deflated, you've lost volume, and you're happy with the bra that you're wearing a C cup bra or a D cup or whatever, and you're happy with that, but when you take your bra off, your breasts sag. Then if you're happy with that bra, I would say to you, you don't need implants, because this patient is saying, I'm worried about implants, which I can totally understand. If you're happy with the size of your bra, you don't need implants. If you're a B cup and you want to be a double D or a D cup or something like that, then you do need implants. So implants are really good at adding volume. So implants are for the volume, for the cup size, making the cup size bigger. The lift is for the shape. So if it's predominantly one problem, whether it be just predominantly shape and not that bothered, you don't want them a little bit bigger but not much bigger, then I'd say go for a lift. If it's predominantly volume and not so bad on the shape. Look, I'm happy that the shape, they're sitting a bit low, but I'm not that bothered by that, and they're not too low, but they're really too small, then you could maybe just have implants. And that's the way I usually advise people to go, to try and maybe have one if one's a predominant problem. But if it really is the shape and the volume, if they're sitting low and they're too small, you want them bigger and lifted, that's when a lifted implants combined comes in. I hope that, yeah, I hope that sort of answered it. And really, you do need an examination to see whether you need a lift or not, because some people really do need a lift. If your breast is sitting really low, then you do need a lift, and whether you have implants or not is your choice. But a lift is a given. If your breast is sitting really low, you can't just have implants, because they'll just still sit low, and your implants will be here, breasts down there. That won't look good. But if they're not too low, then you might be able to get away with just implants if you did want to be significantly bigger. Oh, has that helped? Susan says that. So Kim's in the house. Hi, Kim. Susan's looking forward to your opinion on my arms. I've got your arm, but I've got you loaded in, Susan. I've got you loaded in. Hokey Stokey. That is really great, informative. Well done. I thought I was rambling. Blimey. Just shows you can please every now and then you get it, you know. If I put on that on YouTube, I'd get all sorts of comments about how much I ramble. They keep on putting those comments on YouTube about how much I don't get to the point, but I'm a professional. I'll rise above it. Kim, should your belly button still have stuff coming out of it 7 weeks post-op, does not look infected, nor does it smell? Just a bit concerned. Thank you. So in answer, strict answer to your question, Kim, no, it shouldn't. But I wouldn't be too worried about it if it's not smelling and it's not sort of offensive. It doesn't look infected. The belly button is a naturally deep, dark hole. You know, it's not a very clean area. And so it's one of the problems area with a tummy tuck. It can be a problem with infection. Or it doesn't sound like you've got infection, but you might have sort of a stitch there or something which is continuing to making it continue discharge. I think it's worth seeing your surgeon, because there might be a foreign body there or something there that's just irritating and not letting it heal. But I wouldn't be too concerned. But I think you certainly need to see a surgeon or your nurse or whatever, just to have things checked, just to check there's nothing there that's causing it to continue to discharge. But as long as like you've hit the nail on the head there, saying it's not, doesn't smell and doesn't look infected, those are the things I'd worry about. If it starts to look infected, then I would worry, but not too worrying. But it's a bit of a nuisance, isn't it? 7 weeks, but nothing too drastic. Can I have a tummy tuck and be 196 pounds, 5'4"? The two things about the weight and a tummy tuck, Sharon. Number one is your BMI. Do you know what your BMI is? Body mass index. It's your weight in kilograms divided by your height in meters squared. So kilograms per meter squared, if that makes sense. You can get it on the internet, you do BMI calculator. Most of the studies on tummy tucks have said that a BMI less than 30, you've got less risk of complications, and if your BMI is above 30. So basically there's two criteria with regards to the weight. One is your BMI, so you ideally want your BMI to be below 30, because you statistically got less risk of complications. Not that anything magical happens at 30, but the lower your weight, the less risk of complications. But also, the lower the weight, the better your result. You really don't want to lose weight after surgery, because so if you're happy with your weight, then that's okay. But if you want to lose weight and say, oh, they've got this here and stopping me from losing weight, and once I get rid of my tummy, then I'll be able to exercise better and everything. I understand that argument, but actually you're going to get a better result if you lose the weight first, because if you lose weight, you actually get more of an apron. The reason people need a tummy tuck is because they lose a lot of weight, because the skin doesn't recoil. So actually you want to lose your weight before having a tummy tuck and get down to your ideal weight that you're stable at, that you're comfortable with, because then you get a better result, because then you can make it as tight as you can when you do the tummy tuck and give you a nice result. If you make it as tight as you can now and then you go on and lose weight afterwards, you might have some redundant skin, and you might have paid all that money and still have a bit of redundant skin, which would be a bit annoying. So you want to avoid weight fluctuations after surgery, either down or up. You don't want to put on weight either, because if you put on weight, it'll go on your tummy again. Your body doesn't say, I paid thousands of pounds for this surgery, so I'm not going to put on weight. So I'm not going to make this tummy look worse. It will just get bigger, just like it would have before. So ideally, you want to be stable and comfortable with your weight before having a tummy tuck. Tanya Charles, how you doing? Would it be possible to change implants during revision surgery 11 months post-op? Yes, absolutely, totally possible. 11 months post-op is quite a long time, and that's absolutely fine. Changing your implants would be absolutely fine. Yeah, that's absolutely fine. No problem with changing your implants at all. Kim, thank you, Dex. You're welcome. Sharon, 33. Is that BMI? Okay, BMI 33. Yes, that's a bit high, Sharon. So yeah, if you can get it down a bit, that would be good. Chantel, is there any indication that varicose veins in your thigh would be too risky for a tummy tuck surgery, or what's the actual risk involved, if any? Someone said this a little while ago. They said a surgeon would, I don't know if they wouldn't operate, or they said that you got to get your varicose veins fixed first. I don't look for varicose veins at all when I'm seeing a patient with tummy tuck. So the main thing that we're worried about in this, so in my opinion, and I've gotta say this is just my opinion. Um, just my opinion. I don't have a problem with operating on people to do a tummy tuck with varicose veins. The problem I would imagine, and this is you, if a surgeon has said to you they're worried about it, then you've got to ask what they're worried about. But the problem that I would foresee is DVT, clots in your veins in your leg, which can fly off into your lungs and be serious. That's a bad complication, and it's a risk when you do tummy tucks. Risk with any surgery, but it's a particular risk with tummy tuck. So they but that's the deep veins rather than the superficial veins, which are the ones that are a problem with varicose veins. So I haven't got a problem with it, but so I am okay with doing it on people with varicose veins. So you'd have to split there. I've heard this before, so there must be surgeons out there who are worried about varicose veins. So you better speak, if your surgeon is worried about it, you better ask them about the risks and what they think the best thing to do is. As I say, choose your surgeon's best thing rather than minutiae of which operation, what have you. Sharon says, thank you, Sharon. What we got? Here we go. I've broken my wrist and it's in plaster. My op is 3 weeks away, and I'll still be in the plaster. Will my surgeon still do my tummy tuck? Well, again, probably best asking your surgeon, number one. But let's just hypothetically say I was your surgeon. I would say to you, how do you feel? I broke my wrist. It's in plaster. My op is 3 weeks away, so you're at least 3 weeks in plaster. In itself, it's not a problem, but you're going to be a bit knocked back from your tummy tuck, and you might want to do it at a time in your life that's more convenient when your wrist is fixed. So I wouldn't say it's an absolute contraindication. I wouldn't say it's a definite no, but I think it might affect your recovery if you've got a tummy tuck, you've got all the stress of trying to get over that, and your wrist is, causing you problems, and hard to move about and get out of bed and what have you. So it might be, if it's okay with you, to maybe reschedule it to another time. Now you might say, I've sorted out my life and I've got time off work, and there's not going to be another time. It's a really good time in my life to have the tummy tuck, and I'll accept the fact that it's going to be more difficult to recover with a plaster on my wrist, in which case fine. But that's what I would say. I would say, I would be like that. I'd be like, well, it might be an idea to reschedule, since it is elective surgery and you don't have to have the surgery now. It might be an idea to reschedule it, but I wouldn't say you would have to reschedule it. After breast uplift, when can I wear an underwire bra again? Again, this is up to the surgeon involved, the specific surgeon. Everyone's got their own views about underwired bras and when you can wear them. But broadly speaking, the underwired bra can irritate your scar. So that's why surgeons worry a bit about it when you've had a breast uplift. And so I normally say 4 to 6 weeks. So I normally say a supported bra for 4 to 6 weeks. So call it 4 weeks. Then see how you go. Depends on how it's all healed. Sometimes you get a little bit of a wound not healing up properly down at that T junction. So you might have a bit of irritation, and you might think the wire of the bra might annoy that. So after about 4 weeks, if it's all healed up okay, you can see how you go. And the stuff with all this sort of thing is not to take it like, hooray, I can wear a bra. And if it rubs and irritates, push through because the surgeon said it's okay. Start gently, see how you go. Wear it for a couple of hours, see if it's okay. If it doesn't irritate you, if it doesn't hurt, then that's fine. But if it does hurt and does irritate and your breasts swell up because they've not got as much support, the underwired bras, then go back to the support bra. But after about 4 weeks, I would say you can start getting back into an underwired bra and see how you feel. After a tummy tuck with muscle repair, when can I do sit-ups again? I'm 6 weeks post-op now. Again, better check with your surgeon because obviously, as you say, the muscle repair does sort of bring those rectus abdominis muscles together. And again, if it was me in my practice, I say 6 weeks. Start just like the bra thing. Start to get back into things. So gently do a couple of sit-ups. Don't go to some what they call it, circuit training, where you have to do 20 sit-ups and then you run around the room and everyone's going, come on, do more. Don't do that. Just do it quietly in your own house or in your own space. Gently see how you go, and if it hurts, if it swells, think, flipping heck, I'm not doing that again. And if it doesn't hurt and swell, then think, oh, that's not too bad, I'll carry on. So 6 weeks you can gently start getting back into things if you're feeling okay, and if the pain's not too bad, and gently slowly increase it. What age is suitable for a pinnaplasty? My son wants his ears pinning back. Is there an age when the surgery is preferable? He's 11. So yeah, I mean, the thing about pinnaplasty, you really want the child to be on side with it. So sometimes people come with small children and they don't want them to be bullied before they start school and all this sort of thing, which you can totally understand. But if the child doesn't know what they're having done, then it can be a problem with compliance of the child. The child's going to theatres like, what's going on? They kick, they fight. They're like, I don't want to go to theatre. So you really want to have the child on board. So really, the sort of lowest age is usually around 6. 6 is the sort of usual time for a prominent ear correction. And what you're looking for is what we're looking for as surgeons. We're looking for this child to be saying, I don't like my ears, and I would like my ears to be a better shape, rather than the parent saying it, because at the end of the day, it's the child you're treating, not the parent. And so if the child's fine with it and the parents say, well, I'm worried they're going to get bullied, I'm worried about this and that, it's, you really want the child to be um, uh, verbalizing concern rather than just the parent. So 11 is fine. Once you get up to the 11 stage, obviously with a 6-year-old, you're going to have to do it under general anesthetic. On older people, you can do it under a local anesthetic. 11 is probably still too young to do it under a local anesthetic, so you probably still need a general anesthetic at 11. So maybe if they could wait till they're older, 16, 18, 20, you might be able to do it under a local anesthetic, which will make things a little bit easier. But certainly, 11's a reasonable age to have the surgery. And as I say, 6 is the sort of starting age, really. Anything younger than that, and the child doesn't really know what they're having done, and it's not really a good practice to be doing that. When can I swim after having a breast reduction? 8 weeks post-op from breast reduction and still got a small opening on the T-scar. That's what I mean about that T thing. I'm going away in 10 days. Can I swim with a waterproof plaster on? Again, probably best talking to your surgeon to get an opinion on that. But my opinion on that would be that I wouldn't swim with a waterproof plaster on. They call them waterproof plasters, but they're like splash waterproof. They're not proper waterproof. You try and get it submerged in a swimming pool or what have you, it'll float off. They won't stay. So I wouldn't probably swim with a waterproof plaster on. I would normally say that when you don't need a dressing, and if you have any gauze or anything in your bra, or if you're wearing a bra and there's nothing on the bra, that's when you can start swimming in a pool. If there's still exudate, if the wound's exudative, if there's stuff on your bra when you take your bra off, if you haven't got a dressing on, or if you're still needing a dressing, I wouldn't swim in the swimming pool. In the sea, you can swim. You can swim with it, and again, I probably wouldn't put a dressing on. I'm hoping it's not like a big wound breakdown, but assuming it's just a small little bit of weight wound breakdown, you can swim in the sea with a bit of a wound breakdown at the T-junction. But again, as I say, I wouldn't put the waterproof dressing on because I just don't find that they're that waterproof. They're just sort of splash waterproof. But I'd probably go without a dressing and swim and then dab dry and then put a new dressing on. But that's me. Better, as I say, better check with your surgeon. What's your opinion on my brachioplasty? I'd like an opinion on my surgery. I had 3 months ago in Poland. I feel there's a difference, but nowhere near as small as I expressed I wanted, and they could have been, in my opinion, of course, but I'm not sure medically if that's all they could do, and I was expecting too much. Please help. This is my before and after. I've just this morning been offered a revision, but at more expense. So, and what we got here, guys, is we got photos. So, I'd like that bigger, really, but how's that? Well, that's better, isn't it? So that's one side. Ooh, and that's the other side. So, so this is a really good one, really good question. This, and I think I can, and I can see both sides. I can see why you might be thinking. I was hoping it would be better than that. First of all, arm reduction is a big op, and there are potential complications with an arm reduction. And we do no harm. That's the thing about being a doctor. Don't do any harm, and we try not to. We just don't want to make things worse, and we don't want to give wound healing problems. And that's one of the balances you got with any sort of body contouring, because body contouring, you're closing things tight, and if you close it too tight, it can open up and you can get wound healing problems. And that's the problem with any surgery. And arm reduction is a notorious one for that, because you've got to be really careful when you do an arm reduction. And arm reduction is a difficult operation because you've got to get the contour of the arm. So the arm has got to be a bigger diameter, a bigger circumference than the forearm. You want the arm bigger than the forearm. You don't want it the same as the forearm. And you certainly don't want to overdo it, because if you overdo it, you get like a shark bite. You get a sort of dish. So you want to have a nice contour to the arm. And they've achieved that. They've achieved that contour of the arm. That looks like a natural contour of the arm. But I can understand what you're saying. I've had surgery and I want it to be smaller than that. Now, one thing I'd say is your weight. Is your weight still too high? Was it too high having the surgery? Before you have any of this sort of body contouring surgery, it's always good to get your weight right. So I don't know if your weight, if you're stable and comfortable, and if your weight's right at this point in time, because that's one thing I'd say by looking at your arms. Maybe your weight could have been lower before having surgery. I mean, that's probably not helping you right now, but because you want to keep the arm in keeping with your body. You want to keep everything in keeping. You don't want to have like a tiny arm and then your forearm and your shoulder and your lateral chest wall is out of proportion with it. So we're always trying to keep things in proportion. So I can see good things about the result. I can see that it's healed well. I mean, the scar's a bit red, but it's not that long, is it? I can't remember how long it is from the surgery. Where is it? We've got it here. 3 months. So it's only 3 months. The scar's often a bit red at 3 months. So I can see good things about the surgery. It's difficult surgery. There's a risk of overdoing with an arm reduction, but I can also see what you're saying. When you look at the result, you think, well, it's definitely an improvement, no question about that. And you're saying you've been offered a revision at more expense. I think at this stage, I wouldn't be thinking about revisions. I think 3 months is too soon. I think that's healed beautifully. The problem with the revision, we're always trying to make people happy when we do revisions. And the problem is that if you do too much, then you do get this dish deformity, like shark bite. I don't know if you can imagine that, sort of like a dent. Instead of having a nice rounded contour, you have a dent if you take too much away. You have to keep in mind the natural circumference of the arm when you're removing tissue. You can't just remove it as a straight line across, because then you get a dish and a dent. So there is a risk of overdoing it with an arm reduction, and if you overdo it, it looks worse because it looks unnatural. It looks weird. You don't look unnatural now. You look natural. You don't look as good as you wanted to look, but you do look natural. So I would be very wary about doing a revision. I would think about maybe losing weight, and I would think about giving it some time, letting that scar mature. I think 3 months is too soon for a revision, given the issues that you've got. And I think that you have got a reasonable, or even a good, I think you've got a nice surgical result. But it obviously, the problem with all this sort of stuff is it's not all about what the surgical result is, it's about what you think. And if you think that they're not, if you think it's too much, and certainly if you think it's more than what you thought it was going to be pre-op, that's a real problem. And that's all when it comes down to patient expectation, which is a huge part of the job. Patient expectation, letting people understand what they can expect from surgery, so you avoid unhappy patients like this situation, where someone who's got an acceptable surgical result but is actually unhappy with it. So that's one of the challenges of this job, to be honest with you, because we are very much at the mercy of our patients when it comes to whether we're having a good result or not. It doesn't matter what the actual result is. It matters whether the patient's happy with it. And if the patient's not happy with it, then it's not a good result. So this is not a good result because you're not happy with it. So, but as I say, surgically, I think it's not bad. And I would probably be inclined to hold off revision surgery. I certainly wouldn't be going from, paying more, and I would give it some time, try and lose some weight, and just try and focus on the good things about it. It's healed nicely. It's got a nice natural contour to your arm, and I think there's good things about it, and I would try and focus on those if I was you. And thank you very much for letting me show those photos. That is very, very helpful of you. Buonasera. Anna has done the little doctor facial emoji. So I should have given you fair warning, guys. That was the last question. You heard me. That was the last question, and that was a photo. That was a corker because a photo, and really, that's what we want to start getting into. We want to start getting into photo questions. That's what we're talking about. So that was the last question. If you have any questions, then speak now. Just keep that up there. Put it down. Full screen. Yeah, got any questions? Got it? I thought we had quite a few. Did I rush through those a bit? I thought the first one, I thought I'm waffling too much on this first one. Panicked, cracked through the rest, and look at me now. Got through too quickly. Oh dear. Oh dear. Oh dear. Anyway, I'll have to reflect on that. Sorry if I went through things too fast at the beginning. Big issues, tummy tuck and breast op, breast lift and implants and whatnot. Big issues there that we covered, and I understand why it's all confusing. So yeah, choose your surgeon. That's the take-home message. Check out for my blog post, which I'll be putting up in probably the next 24 hours. My blog will be going up about choosing a surgeon is more important than worrying about what sort of operation to have. Thank you all for listening and for being here and being part of it and for commenting and liking. Have you liked? I don't know if you like, but if you have liked, thank you for that. And also thank you for asking questions and letting me show the photos. Very, very grateful to you for that. And I hope it's been helpful. If you have any questions, message me, Facebook me, get in touch. I'll be happy to answer them to you directly. And if you like, I can talk to them here totally anonymously. I will never mention your name or anything like that because that's up to you whether you want to share who you are. And so I've got an early bath, haven't I? So that is thank you all. Without further ado, and am I missing something? No, I don't think I'm missing anything. And I'm going to check out. I'm going to check myself out, and I'm going to see you here, same time next week. So please continue with your questions. Thank you all for that, and I will see you next time.